Across the country, including here in Texas, we're experiencing a shortage in nurses, therapists, pharmacists, and more healthcare providers. So to help address these shortages, schools dedicated to a career in healthcare are opening as young as high school age. Joining me today is Dr. David Callender with Memorial Hermann Health System. Good morning, Dr. Callender.
Good morning.
So can you tell me about this partnership that you guys are doing with Aldine ISD?
Yeah, and we also have Dr. Latanya Goffney from Aldine ISD on with us this morning. We're very excited about this partnership. It opens a new opportunity to introduce young people to careers in health professions. Aldine is just proving to be a marvelous partner, so very excited to be able to form the Heal High School and move ahead.
And so what would the curriculum look like for these students?
Well, let me turn it over to Dr. Goffney. He can describe that.
Yeah, we're really excited about the pathways and the different opportunities it's going to provide for our students. We're going to have nursing, we'll have imaging, we'll have physical and occupational therapy, non-clinical administration, as well as pharmacy. And so initially the curriculum will look similar to what any other ninth grade students will have, but they'll have the opportunity to have very hands-on learning alongside Memorial Hermann staff that will open their eyes to the different opportunities that we described in the 5 pathways. So we're really excited.
How would somebody get into this school? I mean, I've researched myself the crisis that we've got with the shortage of nurses and healthcare workers. So if we know that a young person has interest in pursuing a career in healthcare, how would they be able to enroll in your school?
It's simple. We have an application that's open right now. In addition, we're doing interest meetings with all of our 8th grade students who are going to be in 9th grade next year. And we're also making sure and partnering so that they all know. We know that when kids and families have good information, they can make good decisions. But the most important thing we're excited about is providing models from Memorial Hermann who will show our students what's possible. What we found is many times our students only interact with a nurse when they go to the doctor, but to be able to ask questions, be able to have mentors, be able to go and visit the hospital and have these real world experiences in our classrooms during grades 9 through 12 is going to be life-changing for our students.
And Dr. Callender, would they be able to go directly from this school into a position at, say, a hospital system like Memorial Hermann? I mean, we're talking about 18-year-olds.
Yes, absolutely. They'll be prepared. In many cases, they'll actually have achieved their certification that's necessary to begin their professional career. So the idea is they graduate career ready.
Yeah. I mean, I guess if an 18-year-old was good enough to take care of us during World War II, they're good enough to take care of us today, right? That's a typical age for several professions, at least in the past. Now we're just used to hearing people, go on to a secondary school and have to pursue that degree. So this is pretty impressive that if you know what you want to do, this seems like to be the right option for you.
Yeah, we're very excited about it. Obviously, it addresses what you mentioned at the outset, which is the severe shortage of health professionals that we have. But it also gives us an opportunity to work with a group of young people to talk about the concepts of health and health care and potentially spread that message out to their families and into their neighborhoods too. And so just another part of this marvelous opportunity.
Yeah. In case people don't know at home, I will emphasize that this shortage of healthcare workers is affecting you, whether you think it is or not. I mean, if you have an emergency right now, most emergency rooms across our area, you could be sitting in the waiting room for hours. And a lot of that is because of staffing issues. So to form something that would create a pipeline directly into our local health organizations, I think is pretty brilliant. What is the ultimate goal for Heal High School?
Well, we're excited.
Go ahead, Dr. Goffney, sorry.
We're excited too because not only is it going to provide opportunities to enter into a high wage job, but it's going to be a ticket out of poverty for many of our students. As we think about the fact that 90% of our students come from free and reduced economically disadvantaged homes, and so being a first-generation college student myself, our students going to graduate with a ticket to go into the workforce and have meaningful jobs that are going to help them to help their families and also to help them through college so that they don't have to get the debt that some of us have had to get as first generation college students.
Yeah,
Yeah, that's
bypass
very
that. Yeah.
important. And the Bloomberg people see this as the creation of models like this one in Houston. There are others across the country that can be replicated at in other urban areas with other school systems and health systems. So we're very excited about that opportunity too. It's a great way to introduce local students to the health professions who might not otherwise get that exposure. And we hope that the model will be extended in the future to offer that opportunity to that many more students around the country.
Yeah, I think that's a great idea, and good luck to the both of you. We really appreciate your time explaining that to us this morning.